Today, I want to talk about a topic that I initially tried to avoid. Recently, respiratory infections and pneumonia have been spreading widely, and I feel it's important to address them. At the time, I advised people not to worry too much about HMPV and instead focus on more serious concerns, such as influenza virus respiratory infections. In particular, due to COVID-19, as many people have spent the past 4 to 5 years in isolation, practicing social distancing, and avoiding gatherings. As a result, the number of cases of colds and pneumonia significantly decreased. However, this also led to weakened herd immunity and reduced individual immunity due to a lack of exposure to these infections. However, as the situation continues to develop, I feel the need to discuss it. Over the past month, our hospital has seen an increase in severe pneumonia cases rather than just flu cases, with many patients experiencing bacterial respiratory infections. Due to the increase in severe pneumonia patients caused by infections, we have had to provide extensive care for them. Many of these patients come to the hospital without appointments, making the hospital even busier. As a result, scheduled patients have had to wait longer, leading to numerous complaints. I used to talk about the flu vaccine maybe once every 1 or 2 years, but every time I did, I received a huge amount of backlash. Honestly, I expect the same reaction to this video. Since January 2020, when COVID-19 first started spreading, people have followed strict social distancing and hygiene measures. While this had some positive effects, it also led to weakened immune systems due to a lack of exposure to infections. I had anticipated that there would eventually be a major outbreak, and many others had expected this period to arrive as well. Now, prescriptions for cough medicine are in high demand. If you haven't caught a cold yet, the most important things you should do are: avoid contact with people who are sick and wash your hands frequently to maintain good hygiene. Many people have gotten into the habit of wearing masks due to COVID-19, but masks do not provide as much protection as people think. In fact, people often feel a false sense of security while wearing masks, leading them to spend more time in public settings and actually increase their exposure to infections. Since masks are not as effective as commonly believed, washing hands frequently is much more important. But most importantly, the best way to protect yourself is to stay away from sick individuals and avoid close contact with them. This is especially crucial for people over 65 years old. Elderly individuals, as well as those with weakened immune systems due to conditions such as diabetes or undergoing chemotherapy, should be especially cautious over the next month to avoid respiratory infections. I strongly emphasize the importance of taking preventive measures to protect yourself. Now, I'd like to talk about the flu. The flu and the common cold are completely different illnesses. Receiving a flu vaccine does not make you catch a cold. However, after getting vaccinated, some people may feel slightly unwell or experience mild fatigue, but this is not an infection. Most people recover within a day, although in rare cases, some may feel under the weather for 2 to 3 days. If someone claims they got the flu after receiving the flu vaccine, statistically speaking, it is likely that they were already infected before getting vaccinated or contracted the flu on the same day. Studies show that during flu season, there is always a percentage of people who catch the flu or a common cold regardless of vaccination. When someone develops flu-like symptoms within 1 or 2 days before or after visiting a clinic for vaccination, they often mistakenly believe that the vaccine caused their illness. However, looking at the data, among 100 people who receive flu shots, a certain number would have naturally contracted the flu within that time frame, regardless of vaccination. This misunderstanding leads to the false belief that the flu vaccine causes illness, which is not the case. If you do contract the flu, taking antiviral medication like Tamiflu within 24 hours is the most effective treatment. It can still be taken within 36 to 48 hours, but the sooner, the better. However, in reality, most people do not seek medical attention immediately after feeling flu symptoms. Many think they just have a mild cold and wait a day or two before visiting the hospital, often delaying for 3 to 4 days. By the time they take Tamiflu, its effectiveness may be reduced. Despite this, if an influenza test confirms the infection, doctors may still prescribe Tamiflu, as it can still provide benefits even if taken later. When the virus is actively replicating, taking Tamiflu can be highly effective in treating the flu. However, if you take it after 3 or 4 days, when the virus has already started to weaken, the medication may seem ineffective simply because too much time has passed. While some individuals may experience side effects from Tamiflu, they are generally not severe. Many people still confuse the flu with the common cold. The common cold is caused by viruses such as rotavirus, rhinovirus, and coronavirus, whereas the flu is caused by the influenza virus, which is entirely different. While the symptoms may be similar, the causes are distinct, leading to different treatment approaches. Recently, both colds and the flu have been spreading widely, and in severe cases, they can lead to pneumonia. Some people believe that they should take antibiotics as soon as they catch a cold, but this is incorrect. Colds and the flu are viral infections, and antibiotics only kill bacteria, not viruses. This is why antibiotics are not prescribed in the early stages of a cold or flu. When patients visit the hospital, they are given Tamiflu if they have influenza, while those with a common cold receive symptomatic treatment, fever reducers for fever, pain relievers for headaches, nasal decongestants for a runny nose, and cough suppressants for coughs. However, if symptoms worsen after 7 to 10 days, antibiotics may become necessary. Although viral infections initially weaken the immune system, bacteria that normally reside in the upper respiratory tract can take advantage of this weakened state, leading to bacterial infections. When this happens, symptoms become more severe, and the infection can progress to pneumonia or lower respiratory tract infections, requiring antibiotics. Some patients mistakenly believe that they should have been given antibiotics from the start, but the reason for waiting is that the infection initially begins as a viral illness. If the immune system fails to fight off the virus, bacterial infections can develop later, necessitating antibiotics at that stage. Currently, after the COVID-19 pandemic, the transmissibility of the coronavirus has significantly decreased compared to 2020. However, common colds have become more severe and prolonged, leading to an increased number of pneumonia cases. Unlike 6 to 7 years ago, the common cold should no longer be taken lightly. Taking antibiotics at the onset of a cold is not recommended, but if symptoms worsen, it is important to consult a doctor. Today, 2 pneumonia patients were discharged from the hospital. One patient had been sick for 4 days and, due to an underlying immune deficiency, developed a severe lung infection requiring immediate antibiotic treatment. In contrast, their spouse, who lived in the same household, was prescribed Tamiflu instead of antibiotics. This demonstrates that treatment approaches vary depending on individual conditions, which can sometimes lead to misunderstandings. Many people have already received their flu shots, and our hospital no longer has flu vaccines in stock. However, since it is still flu season, I strongly recommend that those who have not yet been vaccinated visit a pharmacy and get their flu shot. Receiving the flu vaccine does not guarantee that you won't catch the flu. However, it significantly reduces the severity of the illness and may prevent infection altogether. For example, someone who might have been hospitalized with pneumonia and required a ventilator could instead experience only mild flu symptoms at home. This is why we recommend the flu vaccine based on statistical evidence. It is important to understand that the flu vaccine is not a cure-all or a 100% guaranteed protection, but rather a preventive measure that lowers the risk of severe illness. Please keep this in mind when making decisions about flu prevention and treatment.